Again, Lagoya Charton going along, Jane, but Sabani President William Ruto got it to one, taking a thing or to Tika. Not on Gobunge, Neboboro, Bunge, Nebo Senator, Cohen Katiba, Nebo Imoni, Konya, Gunga, Jugan in the Tabi Meta, got it to one, taking a thing or to Tukonya Genge, in Kini Tagatugula. Kaigi President William Ruto, Gigo Mochko line, Jet to get Terra, Sergalit, and Nebo Kenya Kwanza, or got to Noitaki, Nebo Gomuch Coastal line, to Tukuin, Emotinuega, Chigo Batach about a mate Nebo Singapore. Let's go in Lieutenant President William Ruto, le Mogul Agotin Kandan, Coaching Doiri Yuega, and Council Light Voice in a Kenya 6 Mokiot Chicago Bataitam. Bogondoch Emoni, Kenya Kwanza, Octago Mitten, Itunda, and talking gay Emoni Borotit, in a pay to second meter tire. Kama President, Kole, Asigobit Coastal Lanitana, Committee Sector, Chigigo Mochkoganapta, Sergali, Kubota Itunda Nemni, and Castle Light in Voice Uniga, Chegos Latte to Tukul in Yamimida. Bigabe Metukul Moto Secretary. Again, doing a tet in the Migo go bit to get me a chain, a chigo turret, Emoni, got time.
At a time like this, in 2022, Kenya was in distress. Inflation had soared almost to double digits. A fuel shortage threatened to paralyze our economy as oil marketers struggled to access dollars. The shilling was in free fall. Foreign reserves had hit historic lows. Debt service consumed more than half of our revenues. Confidence, both local and foreign, had waned. International analysts warned that it was no longer a question of if, but when Kenya would default. Within that context, we acted. We restored fiscal discipline. We eliminated wasteful subsidies. We rationalized public expenditure. We strengthened revenue collection and placed our economy on a path of recovery and sustainability. Inflation, which stood at 9.6% in 2002, in 2022, has steadily declined to 4.6% as of last month, bringing much needed relief to households. The shilling, once in perilous downward spiral, has stabilized at 129 to the dollar for nearly 2 years, a direct consequence of prudent monetary policy and disciplined fiscal management. Our successful Eurobond redemption signaled to the world that Kenya honors its obligations. 3 years ago, Kenya was ranked the 8th largest economy in Africa with a GDP of $115 billion. Today, our GDP has increased to $136 billion, moving us up to become the 6th largest economy on the continent, according to IMF. This steep rise, ladies and gentlemen, is not accidental. It is the product of deliberate choices, disciplined execution, and strategic reforms that have strengthened our economy and unlocked its potential. Our foreign reserves have surpassed $12 billion, the highest in independent Kenya. This has restored certainty, cushioned our economy from external shocks.
Otinge after to chiki matellinda ene morning mo President William Ruto kola go yeni goni go mo ko serga biga e moni chita million tuptem act saba e to get ne baga nyoy set ne basha lenneton go go it na nyilien somok to get ne gibota ne ba NHIF garor go ne kete suje ke sire elfo sector man in e moni ko mogol go go en go serga en system initon lel basha aga se ko bit ko sulaniton go wendi serga alit ne ba e moni ko gere go le kan yor sire ne ba boy tini ke changa ko re tage
Mr. Speaker, honorable members, let me now turn to healthcare, the foundation of human dignity. and the heartbeat of every nation that chooses compassion over neglect. Over the last 3 years, we have undertaken the most ambitious transformation of health systems since independence. Reforms rooted in equity, powered by innovation, and guided by a simple conviction that every Kenyan, wherever they live and whatever their means, deserves equal care. 27 million Kenyans are now registered in SHA, more than triple the number ever reached by the former NHIF. This is a demonstration that leaving no one behind was and is not a slogan. It is a promise on course to fulfillment. Additionally, more than 10,000 health facilities across the country have signed in to serve under this new system. But honorable members, real healthcare begins long before patients reach a hospital. That is why in September 2023, we deployed 107,000 community health promoters, the largest primary health workforce in our history, trained, equipped, and present in every ward in all our 47 counties. Their impact has been extraordinary. Consider 3 statistics. 8.9 million households have so far been visited. 9.9 million diabetes screenings have been done with 134,000 cases diagnosed. 6.5 million